Thanks everyone for your patience. We did just want to give everyone an opportunity to join on to this webinar. We're really excited to be bringing Todd Green, the Broker Account Executive at Pivot Health, on the line with us. I'm Liz Sisner, the Senior Account Executive here at Allied National. And today we're going to be going over Pivot Health and how to make the selling of these short-term policies easy for you and for your clients. A little bit of housekeeping. Everyone will remain muted throughout the course of the webinar. There will be an opportunity for question and answers. You can type that into the chat and we'll be getting to those at the very end. Additionally, we will be sending out the recording of this webinar along with those Q&As. If you happen to have anything that comes up that you think of after the webinar, please feel free to reach out to Todd or myself. Our contact information will be available at the end of the webinar. And Todd, I'm going to go ahead and kick it over to you.
All right, excellent. Thank you very much. So let me get my screen shared here. All right, good morning, everyone. Thank you for the introduction there, Liz. I appreciate you guys and I appreciate everybody for joining me today. I've got a great presentation. Today, what we're going to be talking about is how easy it is for you to have an additional income stream of commissions through our super easy quoting and enrolling platform. Our site allows you to enroll someone in a variety of individual products all within a few minutes. So it's super, super easy. And this also includes multiple lines, and technically you can enroll your client into multiple products all essentially on one application. So again, super easy. So this is going to show you how easy it is for you to be able to have an additional income stream. So Pivot Health, we do specialize in lower cost options to the ACA. So when you do become contract with us through one of our top partners, obviously Allied, we're going to build you a co-branded website that you can use to quote, enroll. You can also check your book of business, but we make it super easy for you to be able to access all that information. You also have access to a custom agent URL link that is great for you to be able to add to an agency website, perhaps social media. Essentially, it's a self-service link. And also you can certainly email that link off to a client, and that's a great option, especially if you work other options, because it gives you kind of that more hands-off approach, allows you to focus on other markets that you specialize in, such as the group market, Medicare, or even property and casualty, and it's totally self-service. And anyone that enrolls under that link, you're going to be the AOR agent of record on that case. If you're more hands-on, we also build you an agent portal that allows you to be able to email customized quotes, and your clients can actually enroll right from that email. So whether your client needs 30 days worth of coverage, if maybe they're in between jobs, or perhaps they're looking for a longer term solution, perhaps it's, short-term medical is a lower cost option than your COBRA, also lower cost option to your ACA, obviously. But if they're looking for a more longer term solution, you can have coverage up to 3 years in a lot of the states that we're in. Perhaps they're a sole proprietor, or perhaps you've got a client that is needing some help transitioning over to Medicare. Maybe they got 2 or 3 years prior to enrolling in Medicare. So the Pivot Health website, whether you're using the agent portal to build a email quote that you can email to your client, or you're using the specialized URL link, we make it super easy, and you're providing a solution to your clients at a lower cost than an ACA. So what I'm going to do is I'm going to give you a little bit of background on who Pivot Health is. So if you're not familiar with us, it gives you a little bit of background, also what makes us unique. I'm also going to give you a live demo on how you can utilize that link, that special URL link that's dedicated to you, the agent. And then also, if you want to take a more hands-on approach, I'm going to give you a live demo on the agent portal, where you can build a customized quote for your client and then also email that out. But you'll be able to see how easy it is. and then also give you just a very high level on our short-term plans. So this is going to be a really great, very informative presentation for you. So thank you for everyone for joining. So when it comes to Pivot Health, who is Pivot Health? Pivot Health is a product development, distribution, and marketing company. So we're not the actual insurance carrier, but what we are is we build all the products and we put the benefits together. We handpick the carriers that we want to work with, and of course, we only work with A-rated carriers. And then we take our product, build it on their paper, and then we take it to market. So that means that we file it with the states, we do all the legwork, and then of course we administer that, and that's actually administered through one of our top partners, Allied National. So we build the product. And it all is proprietary Pivot Health products. We are owned by an innovative insurtech company called healthcare.com. Now, when it comes to our product portfolio, we operate in the alternative individual medical space. So, we have product for that space. That's going to include short-term medical. We also have fixed benefit options. We have your ancillary options to help complete the benefits package. That way, you can have many cross-selling opportunities with your clients. Technology, which is the main focus of this webinar, just to show you how easy it is, show you how easy it is for your client to use as well. So I'm going to show you how that agent portal works, as well as that custom URL link. When it comes to service, we don't treat agents like numbers here. That's why you have a dedicated account executive, in addition to the great support that you get with Allied. And then when it comes to our insureds, we are rated 4.6 stars out of 5. Here's a snapshot of our overall product portfolio suite. As I mentioned, we operate in the alternative individual medical space. So that's going to include short-term plans. So whether your client is looking for 30 days worth of coverage or up to 3 years in a lot of states, we have lots of plan designs. So if your client is looking for something rich with office visit co-pays and prescription drug benefits, we have those options. But then we also have options where there are lower cost options to help provide additional savings over an ACA plan. We have options that utilize national networks, but then we also have options where the member doesn't have to worry about a network. Typically what we see with ACA is that it's tied to an HMO type of program, and a lot of times that HMO network is very small. So that's not necessarily a good option for those folks that do travel across the country a lot. So our open access plans work great for that audience. And then we also have a line of fixed benefit programs. That is like it's basically a fixed indemnity plan. It's more of a longer term solution because they can keep that plan as long as they want, and actually they can keep it till age 74, but it pays a fixed dollar amount in the event of a qualified accident or qualified illness. It does provide first dollar coverage because there's no deductibles, there's no co-insurance. Then when it comes to ancillaries, we can complete the benefits package. Obviously, the more lines of coverage you have with your client, the more sticky they are to you, the more loyal they are to you. So that's going to include dental and vision options, which there's no options with no waiting periods. Also, there's progressive benefits on a couple of our options, and then the vision add-on to the dental is through VSP. And I'm also going to show you how easy it is to add those additional products. That way you can essentially send your client a shopping cart. But the dental and vision can be sold as a standalone product in case that's all your client's looking for. In addition to another ancillary product that we have is our Latitude Gap plan. It's a supplemental product. Basically, it's a critical illness, accident, hospital indemnity, an AD&D program all rolled into one. And it's a product that pays cash benefits directly to the member. And of course, I'll give you a high level on those plans. I want to show you a heat map. So if you do work other states, these are good opportunities for you to work in other states. Our year over year, our top state is Texas. Coming number 2 is Illinois. With us having 2 different carriers underneath our belt, but all underneath the Pivot umbrella, we're very popular in those Midwestern states that have rewrite rules when it comes to short-term medical, because you can flip the client back and forth without having to go outside of the Pivot umbrella, as long as they can answer the medical questions each time. And then some other top markets. Florida's another great market for us, with plans going up to 3 years. Georgia's another great market, as well as Ohio and the other scattered states around the US. Our overall national footprint, we do have product in almost all states. Of course, you do have some states that are not short-term friendly. They don't even allow for those products to be sold. California and of course New York, a lot of the northeastern states. But we are back in Pennsylvania if you do work that market. So just FYI on that. All right, now to the nitty-gritty of the presentation. Let's talk about how easy it is to work with Pivot, how you can have additional income, additional commissions, and it can be as hands-on as you want or as hands-off as you want. So we're going to talk about that custom URL link. So again, when you get contracted with us through Allied, obviously, we're going to build you that self-service link. And that's great because, if you do work other markets, maybe you focus on Medicare, maybe you focus on group, a lot of times with group coverage nowadays, it's very expensive to add those dependents on there. So with the short-term plan, that can provide a lower cost option because maybe the group doesn't contribute anything towards the dependent premium, or maybe they don't even offer it at all. So that could be a good option. And then if you work the Medicare market, that's your, kind of your focus. And if you come across one of your clients that is getting, you're enrolling them into a Medicare plan, but they have a spouse that's got 2 or 3 years to Medicare. So, if this is going to allow you to focus on those other areas that are sort of your bread and butter. So this makes it super easy. So I'm going to show you how this link works. And also, it's good. So if you have an agency website, you can actually add this to your website. And we actually even have some website ads that you can put this link behind. And this link is including your agent number that you get through Allied. And anybody that quotes and enrolls under that link is you're going to be the agent of record on it. So this is going to allow you to direct traffic to your agency website, and then folks can quote and enroll themselves, and it's all within a few minutes. So it's super easy. If you are already contracted with us through Allied, and if you would have received this link in your welcome email. Now, some of you agents that maybe if you haven't sold in a while, you possibly could need new contracting paperwork. That's possible, but if you can't find that welcome email, please feel free to reach out to me or to Liz. And again, we're going to provide our contact information at the end, and we'll be happy to work with you to get you in touch with the right folks to get you recontracted and get that link active for you again. All right, so now let's take a look at just that link. So again, this is built for you. It's a co-branded page. We make it super easy. So this, again, you just put that link on your agency website through the website ad that I'm going to show you in the next slide. But you can also just email the whole link to your client, and then they can enroll themselves. Now, as I mentioned, it is a co-branded page. So it's going to display, obviously our information, and then it's also going to display your agency information. So, or your upline rather. So obviously you're contracted through Allied. It's going to include the Allied logo. This is also going to include your information. Now, I use the Allied link that they have, that they utilize, but it's also going to include your information. So again, when you do become contract with us through Allied, we're going to build you this co-branded page, and it's going to include all of your information. So your name is going to be displayed as you see here. It's going to display your phone number, and then if somebody wants to be able to email you, so if you send the link out and maybe if they're quoting and they have questions, they can click on the send email link, and then it will actually open up their email, and then they can type in an email and send it to you, and you can of course correspond that way. But your phone number is displayed, so they can certainly always call you. Also, if they're looking at other product, maybe they are wanting perhaps a fixed benefit option. So they can certainly click on one of the product tabs. And if they're looking for just dental and vision, they can certainly use that as well. Now, on the flip side of that, if you want to take a more hands-on approach, well, let me back up really quickly. So, for you to set up your link with a website ad, so you put your link, the self-service link, behind this website ad. They call it a hyperlink, and then you can actually put that website ad on your agency website, and anybody that goes to your agency website can click on the little ad, and then it will take them to this page. Now, in order to be able to get that website ad, it's super easy. All you have to do is, once you get contracted with us and, we send you your link, what you'll do is you'll set up your agent portal, and this will allow you to download brochures, customizable marketing pieces, but it's super easy. And I'm going to show you how to get that website ad. So essentially, once you get your agent number, you're going to click on the registration. You're going to plug in that agent number that we give you. And then, of course, you'll log in. Now, if you're already contracted with us and you do have your link, and let's say you forgot your password, you can utilize the forgot your password. You'll just need to get a hold of your agent ID. And again, I can certainly facilitate that. All you have to do is just email me, and I'll try and look you up, or Liz is also happy to assist as well. But you can certainly use the forgot your password feature if you do know your agent number. And once you get logged in, you are going to be into your agent resource center. Now, there's lots of information in here. As I mentioned, there's customizable marketing pieces that you can download, so you can add your agent information on there. So obviously your name and your phone number, and then you can print those out and distribute those out accordingly. But in order to get that website ad, all you have to do is, as soon as you log in, you're going to see the helpful links right in the middle of the page. You're going to go to your business tools, and then you're obviously going to click on short-term medical. And this is going to pull up a page where you can get these additional information, these customizable marketing pieces, but also these website ads that I was referring to. And just to show you an example of what these website ads that you can look at, or you can download to put your self-service link behind. So you put your self-service link behind, you put it on your agency website, and then when members or your clients go to that portal, they can click on get a quote, and then it's going to take them back to that co-branded web page. So again, completely self-service. It's super easy. Clients can literally quote and enroll themselves all within 5 minutes. And the beauty is that, we don't do any, when it comes to our underwriting, we just go based off of the application. It's accept or reject on the spot. So as long as they can answer no to the questions, and I'll show you how that works in the live demo, but as long as they can answer no truthfully to our medical questions, then they pass our underwriting. There's no guessing. There's no running through a prescription drug database or any kind of an MIB type of database. So the members will be able to enroll in a plan all within a few minutes. But this just shows you what those ads look like. And there's some additional ads that you can download as well. But it's a nice feature to have and makes it totally self-service for you. And like I said, anybody that enrolls under that self-service link, you are the agent of record for it, and that's going to create that additional income stream for you, all that additional commission. And of course, we do bonuses all the time. We actually have one now that I'll show you towards the end of the presentation, but you'll also qualify for any bonuses. But yeah, these website ads are great to put that link behind. And again, if you're more hands off, then this will allow you to provide a solution to your client, lower cost than an ACA, and allows you to focus on group or perhaps Medicare, or even I've got some agents that primarily work the PNC market, but they are also licensed in the health, so this allows them to provide that additional solution for their client. All right, now I'm going to show you how to do a quote. So if you are more hands-on, I prefer obviously to have more control over the sale. But this is a great feature for you to be able to take advantage of if you are more hands-on. That way you can build a customized quote for your client, and you can email that out directly to your client, and then your client can enroll right from that email. So you're going to essentially follow the same steps. Once you're set up your agent portal, it's going to allow you to log in, and I'm going to demo that for you right now. So let me go to my page here. Okay. Oops, that's the wrong one. Let me go to mine. Okay. Okay. So you're at your login. You're going to put in your agent number. So I'm using mine, but I'm going to log in. It's going to take me to the agent resource that I just showed you. Now, of course, if you work other states, you can certainly utilize the business tools, and it can show you, other states that we have product in. Also, if you're interested in training and events, we do our own trainings every 2 weeks. So if you want to get up to speed, then you can certainly register for one of our webinars, and we go through all the products. So we do those usually every 2 weeks, but the calendar is available in there. But also, something else that you can do is that you can manage your book of business. So this allows you to see all of your short-term and fixed benefit clients, also your dental and vision, and this will allow you, so if you need to get an ID card for someone, if you need to let them know what their monthly premium is, or show them their extended duration options, their 3-year plans, it's a great feature to be able to utilize, especially if you want to be more hands-on. But we're going to do a quote on a demo on the quoting system, and how easy it is to add products, and also how easy it is to add multiple years, so give you that extended duration option. So as you can see, this is mine. Now, of course, my first name is Mason, but I go by Todd. But this is my information. That's my cell phone number. But and then also, of course, this is Pivot Health information here. But we're going to do a demo on a short term. Now, if you're doing a fixed benefit option, you can use the long term, because as long as they pass underwriting, they can keep that till age 74. But we're just going to do short term. If you're doing child only, you click the box. But we're going to do a quote. I'm just going to plug in information here. You pick your gender, and obviously the name. You don't have to do the email address till the end. And of course, if you're adding any additional people, any additional members, you add the spouse, you can add the child. And again, if you're doing child only, you click the box. And then if you add any of their siblings, you can certainly do that as well. So you can include multiple children on a single policy. Now, you're going to select the desired effective date. Now, the site defaults to next day effective date, but you can certainly do anything in between 60 days out. So let's just say a June 1st effective date. If you're doing, you're also going to make your duration selection here. So if you're doing anything between 30 and 180 days worth of coverage, you're going to make the 180-day selection. But if you're doing a 364 or even multiple years, you're going to make the 364-day selection. I'm going to do the 364 duration, and that way you can see how easy it is to add those additional years. Now, I'm obviously going to give you a high-level review of plans to give you just to show you all the different options that you have available to you. You do have a plan recommender here, so this gives you the most popular plans that are available in that area. Now, if I've got a Florida zip code in here, but you know, any state that we have our fixed benefit option in, you can switch back and forth if you like. Or if you maybe just want to quote dental and vision, you just make you're going to hit the dental and vision tab. But just for demo purposes, I'm going to show you how to you know, pick a couple of plan options, and then you can actually email the whole comparison quote. Now everything is all drop downs, so we're going to make some selections here. Our most popular plan is going to be our Choice 5000 80/20. The max out of pocket does include the deductible, so don't let that throw you. You can change the total policy coverage. And then if you're looking for additional years, so that 3x364 extended duration, great option for those sole proprietors, don't know where they're going to get their benefits for the next couple years, or those folks that have 2 to 3 years to Medicare. The extended duration option is a great feature. Now, if you just want to do a single quote, you can just click on the email this quote. If you want to add additional lines of coverage, you select the box. Now, it's great for convenience purposes because you're essentially quoting multiple products, and you email that out, and your client can enroll from that email, and they're essentially enrolling in multiple products all on one application. Now, of course, there'll be, you know, multiple charges as they're separate products, but for enrolling purposes, it makes it super easy. Now, of course, if you're looking to do maybe a comparison, all you have to do is click on the Add to Compare and automatically get a window that pops up. And that can allow you to compare up to 3 plans. Now, I'm not going to make any changes here, but, you know, again, if you want to make changes, you know, you certainly can do that depending on what your client's needs are as well as their budget. And then I'm going to click on Add to Compare. And then I'm going to click on the orange button that says Compare Plans. You can highlight the differences. So this is a great feature because it kind of lays it out very easy for your client. One of the main differences between the Choice plan and the Deluxe plan is that it includes, you have a discount card on the Choice plan, and then on the Deluxe plan, you actually get a copay drug card. And you can just email that directly to your client and literally just clicking a button. And you're going to enter in their information. I'm just going to do mine, obviously. And of course, this is automatically populates your information, but you know, you can certainly change it to whatever you want. Obviously, you want to keep it your name. And of course, you can do a personalized message, and then you click on send the quote. And you will get, the quote will go directly to your client. It looks like it comes directly from you. And also you do get a carbon copy of that. So that way you have record of that quote that you built for them. Now, if you want to just do the single quote along with the multiple products, you can click on Go Back. And of course, you can click on Go Back, make those changes again, add those additional products. So I'm adding the dental and vision, I'm adding the Latitude Preferred supplemental product, and then I can email that entire quote to my client. So you got the short term, you've got the dental and vision, you've got the supplemental product, and then you click on send. And again, you're going to get a carbon copy of it. and then I'll show you what that quote looks like. And for some reason that's not working. There it goes. Okay, and then you can hear you get it within a few seconds. So here's what the quote looks like. I'll show you the first one. So actually, okay, that's the plan, the single short-term plan with the multiple products, the dental and vision, as well as the supplemental. Let me go back to, that way you can see the comparison. So those two plans that you quoted, you've got them side by side, and it does highlight the differences for you. The member can view the brochure, they can view the details, they can make changes if need be, but if they are ready to go, all they have to do is click on view the quote. If they want to go ahead and apply, they can click the select plan, and then it's going to take them to the medical questions. Now, if you ever have any underwriting questions, again, the site's super friendly, user friendly, so it makes it easy. So if you have underwriting questions, you can certainly play around with this website, and it can show you the medical questions that we ask. And again, we do simplified underwriting. It's accept or reject on the spot. No RX underwriting, no MIB underwriting. So I'm just going to go through these quickly, but I encourage you to, look at these questions. Kind of helps you do a pre-screen. And of course, if there's ever any additional questions, don't hesitate to give me a call. I'm here to support you. But I'm just going to run through these really quickly for time purposes, so that way I can get to the descriptions of the plans, just give you high level, and also some of the things that separates us and helps your clients win. But as long as, again, they can answer no, they pass underwriting. They're going to enter in the rest of their information. And obviously, if you're sitting with them, you can certainly do this for them. So you can certainly do that. But they're going to enter in their rest of their contact information, their billing information. Of course, if they need to make any changes, they can certainly do that here. This is the sort of application summary. The e-signature is part of the end of the policy here. And then, of course, if maybe a parent is paying for the child, and maybe they live in another state or something, they can certainly use the different billing address feature. But super easy. And then once you click on start coverage, the member is going to get a couple of emails from us. One of them gives them instructions on how to set up the member portal. And again, they can navigate that super easily. So that's basically how easy it is to utilize our site. And so again, if you want to be more hands-on, great. If you want to be more hands-off, we have that solution for you as well. All right, so really quickly, I want to go through, just give you a very high level on our plans. We do have a lot of different options. Every single one of these can be written on a 3x364 as long as the state allows for those extended durations. And each one of these different series is built for a specific or particular audience. So we have our core plans, great for your folks that are under 25. They're looking for a cheap premium. They're looking for something that they can go to the doctor with because it has office visit co-pays. There's also prescription drug benefits. They also have access to the First Health Network, so it gives them a network, but it does have limited hospital benefits. So this is more considered of our light plan, because it's going to cap those hospital benefits at a certain dollar figure per day. So again, great for somebody that's under age 25 so that they can go to the doctor with a cheap premium. We have our classic series that has 4 different levels in itself. So you've got lots of plan designs, whether they're looking for something low cost where it's just simple, all covered services are subject to the deductible and co-insurance. upwards to your richer options with office visit copays, and also prescription drug benefits. The plans don't have a network, so any provider, any facility can submit a claim, and it will be paid accordingly. We use reference-based pricing, which gives them great discounts because it utilizes the Medicare fee schedule percentage of, and it includes balance bill protection to protect your client. And it works great. Those open access plans work great because it allows them, if they're traveling across the country, across the United States, any provider, any facility can submit a claim. Also, with the reference-based pricing, it's lower out-of-pocket costs for both their premium as well as their out-of-pocket when it comes to covered medical services. Every single one of those plans also includes first dollar coverage for wellness and preventive benefits. You don't typically see that when it comes to the short-term world. And again, that can be written on a 3x364 as long as the state allows it. We have another series which is great for families because these are our 100% plans, lots of deductibles to choose from. The family deductible is 2 times the individual, and you have first dollar wellness benefits for the entire family. So the wellness mammograms covered at 100%. The PSA testing for men is covered at 100%. Childhood immunizations are covered at 100%. And then we also give some first dollar coverage for every adult enrolled in that plan towards that wellness office visit. Depending on the state, you have access to the Cigna network or the Epic base plan, which is the all access, meaning that there's no network. There's no network tied to it, but you do have some states that have a Cigna version. And you've got an optional copay drug card that you can attach to it, as well as an optional accident rider. So great for families. And great because it's got those wellness benefits for the entire family, and also the 100% coverage after deductible is met. And then you have your Quantum series that's designed for your established entrepreneur. So those folks they still don't want to pay the high price of ACA, but they're looking for a solid short-term medical plan. It has access to the Cigna network. You have wellness benefits baked in. It also includes supplemental accident benefit baked right into the plan. It's not a rider. It is part of the plan. So that's all of our different short-term series. I do want to point out some features when it comes to our short-term plans. This is what separates us. This is what, we have a couple of competitors out there. This is what separates us, because obviously you're going to show, if you're working the short-term arena, you want to do your due diligence. You want to show multiple companies, but this is where we shine and this is where we win, because you want to make sure that you're actually comparing apples to apples. So as you saw, we have lots of plan designs depending on what their needs are as well as their budget. Every single plan, short-term plans, includes first dollar wellness benefits. When it comes to those folks that need a longer-term, short-term solution, we have extended duration options. So again, for those sole proprietors, or perhaps those folks that have 2 to 3 years prior to enrolling in Medicare, you can place them on what's called an extended duration, as long as the state allows it. The benefit of doing that is you're stacking plans on top of each other. And also, by the way, we do simplified underwriting on our extended durations, whereas our competitors don't. So you only have just the initial underwriting, just the first policy. When one policy ends, the next one picks up automatically. So, and again, you don't have to go through underwriting on those. You have no new waiting periods. Your benefits do reset. Now, of course, your deductible and co-insurance do reset, but you also have level commissions. So some of our competitors, when you go into years 2 and years 3, your commission levels drop. Ours don't. It's level all throughout the 3 terms that are tied together. We have options that utilize national networks. We also have our options where they don't have to worry about a network. Those are open access plans. that uses the reference-based pricing with the balance bill protection. Simplified underwriting. Again, we don't do any kind of prescription drug underwriting or MIB. We will take somebody that is controlled high blood pressure. We will also take somebody that is a type 2 diabetic as long as it's diet and exercise controlled. Now, just like any short-term plan, there are pre-existing condition limitations and exclusions. We also don't need social security number. We don't need a green card number, permanent residency number. The only thing that we ask is that they have lived in the United States for 4 months prior to the effective date of the plan. We have a partnership with a company called Point Health. This is a healthcare navigation service that helps consumers to be able to navigate. If they need to find a doctor that accepts the open access plans, they'll help them. And it also includes bill negotiation services. And then we have niche markets under our belt as well. So a lot of our competitors, they exclude those student athletes. So if the student athlete has an injury related to a high school or college sports, our competitors exclude those injuries. We don't. We do children only plans all the way down to 6 months of age. And then our pre-Medicare market, we kind of coined the term bridging your clients to Medicare. And I've been kind of mentioning that all throughout this presentation, which on our extended durations, it works out great for those folks that need help transitioning over to Medicare. And when they're ready to turn 65, you've got a Medicare lead right there. And again, if that's your arena, the Medicare arena, that self-service link works out great because you can just send that to them and then they can quote enroll themselves. And then all of our plans include free and unlimited telemedicine. That includes dermatology. It's not a separate rider. It's not a separate purchase that you have to get in order to get the telemedicine. It's just baked into all of our plans. The best part about it, there's no charge and they can use it as much as they want. And we are backed by our A-rated carriers. Really quickly, I want to mention our anchor plans. These are our fixed benefit options. These options are great for those folks that are looking for more of a longer term solution to combine with other products, such as maybe a high deductible short-term medical plan. Because this is a fixed indemnity type of product, it's going to pay a fixed dollar amount in the event of a qualified accident or a qualified illness. And there's no deductibles, there's no co-insurance on ours. I've also seen agents combine this with a standalone critical illness, a standalone accident plan, but they can keep this as long as they pass initial underwriting, and it is guaranteed automatic renewal to age 74. So another scenario that this could be a good product for is if you have a client that is new to the United States, let's say they're 65, they haven't paid enough into the Medicare system, so they don't qualify for any type of Medicare benefits. This is a product that you can sell them as long as they can pass through the underwriting questions, and it's also simplified. As long as they can pass our underwriting, they can keep the product until age 74. It has access to the First Health Network. There's an entire listing of qualified services that is going to trigger a cash payment. And just to kind of give you a snapshot, you do have 3 different plan options. So it has a hospital admission benefit, hospital confinement, intensive care. You also have emergency room, you have inpatient doctor visits, you have everyday items. You have options where it increases benefits in years 2 and years 3. So these are no deductibles and pays a fixed dollar amount. Now to really quickly touch on our supplemental products and our dental and vision. This allows you to complete the benefits package. So again, the more lines of coverage you have with your client, the more loyal they're going to be to you. We have our dental and vision, We have our products utilizes the Renaissance network, which is a great national network, but incidentally, these are any dentist plans. We have a couple options where there are no waiting periods, including major services. And on our plans, major services actually include implants. You typically don't see that on an individual dental plan. We have options with progressive benefits, so those co-insurance percentages are going to increase over time, including the annual maximum. All of our plans include cleanings paid at 100%, and a couple of our options actually give you 3 cleanings per person per year, all covered at 100%. Childhood ortho is on our max plan, also with no waiting periods. And then the vision component is set up through VSP. VSP, of course, is a household name when it comes to vision insurance, and we give you a $150 frame or contact lens allowance. Another product that you can add to a short term is our Latitude Gap plan. This is that supplemental product that that is going to be a accident, critical illness, hospital indemnity, and AD&D program all rolled into one that pays cash directly to the member, and you can choose a $2,500 benefit or a $5,000. That can be added to a short term very easily. Going back to the dental can be sold as a standalone product. I showed you earlier, if you're just looking for dental, your client, you can just click on the dental tab. All right, now really quickly, I do want to point out some value adds to our short-term and our fixed benefit options. Oops, wrong slide. This is going to help your client be able to really get that value add when it comes to their short-term or fixed benefit plan. All these documents are loaded into the member portal, and this gives them information on how to access the telemedicine, how to access the patient advocacy service, also how to download the Pivot Health smartphone app. And then if they ever go to a provider and the provider has questions on the open access plans, the plans that don't include a network, they can actually show this letter to that provider, and this gives them information on how the plan works, that it is at any provider, any facility plan. They can call the phone number to verify benefits, or they can actually go to the website. So a great letter to help be able to give the provider information on their plan, and in case there's ever any questions. There's also an EDI number, which is an electronic filing system that the majority of the doctors and providers out there use. They all use it, but this gives them what the EDI number is. Really quickly, I want to talk about our bonus that we have for May and June. We have a baseline of 7 medical applications. As long as there's at least a minimum of $100 in premium on the medical application, that's the base premium, doesn't include any app fees. As long as it's at least $100 and you hit your 7, we're going to pay you all the way back to application number 1. And this is unlimited. They can use it as much as you can, once you hit your 7, there's no cap. Also, you don't need to register for this. It makes it also super easy. All right, that concludes the presentation. We got a few minutes left for questions, so let's see if we have any questions in the chat box. And then also, here's our contact information. So that way, if you have any additional questions after the presentation's over, you can certainly reach out and we'll be happy to assist you.
I'm not seeing a lot of questions coming through on the chat board, but it does look like previously I'd gotten some information or questions about that comparison tool that you talked a little bit about earlier, Todd. How many plans can we compare if someone were wanting to really get a good snapshot of what the difference is on, let's say, a core versus the economy plans? Is there something that they could go to see the real differences between the different plan designs?
Well, we've got the comparison tool, which, they can select up to 3 plans, and it's just going to kind of give you the basic differences between the plans. But there's not an actual, other than the brochures, to give you that nitty-gritty comparison.
Perfect. Yeah, I think it would be more a question of just going through and looking at the individual plans, maybe not on a side by side, but kind of familiarizing yourself with what would fall under the core versus an economy or any of the other plan options. So while there's not a side by side comparison, it is really user friendly to be able to go in and see what specific benefits are covered under which policy.
Right, exactly. And then also, don't forget, utilize your support. Call Liz, call me. We're here to help you. If Liz doesn't know the answer, she can certainly reach out to me. We support each other, so please utilize your resources.
And another good option for Allied is that sales@alliednational.com email. It allows any member of my team to connect back with you. So we're all able to do kind of some research on our side and get you the best information possible. And there's that information there.
Mm-hmm.
So it doesn't look like we have any questions coming in. Again, feel free to email Todd or myself or our sales team if you do think of something, and we'd be happy to add that to a Q&A list that we will be sending out with the webinar recording. And Todd, did you have anything else you wanted to talk about today or go over?
No, just wanted to thank everybody for their time. We appreciate you guys, and of course, you guys at Allied, you're one of our top partners. So we certainly appreciate your support, and yeah, don't hesitate to reach out if you have any questions.
Absolutely. Thank you everyone for your time. And Todd, we appreciate you and we look forward to talking to you all soon.
Thank you.
Have a great day.